So did you know that bladder infections and UTIs are incredibly common? They affect millions of people worldwide every year. It turns out UTIs, or urinary tract infections, are the most common outpatient infection in women. Up to 60% of women experience at least one UTI in their lifetime, and many of these infections will be recurrent. Hi, I'm Alison Acerra, registered dietitian with MedShadow, and today we're going to dive in and talk all about bladder health and how you can use food and supplements to manage these sometimes challenging conditions. So first, bladder infections, UTIs, incontinence. Now, these conditions can definitely cause a lot of discomfort, a lot of pain, inconvenience. But as it turns out, there are things we can do to help reduce risk of these infections as well as their occurrence. So let's dive into what causes bladder infections and UTIs in the first place. So these conditions occur when bacteria, typically E. coli, enter the urinary tract and multiply, leading to infection. So factors such as poor hygiene, sexual activity, use of certain contraceptives, and then underlying health conditions could definitely increase the risk of developing these infections. So women are more prone to these infections than men due to just differences in anatomy, with about half of all women experiencing a UTI at least once in their lifetime. Now, interestingly, one review found a link between the bladder and the brain, highlighting that patients with bladder disorders seem to frequently be accompanied by mood disorders like depression and anxiety. They also found a relationship between bladder disorders and the gut, noting that IBS, or irritable bowel syndrome, and inflammatory bowel disease, or IBD, were occurring at the same time. So more research is needed really to understand these potential links, but it may provide some insights into who may be at higher risk for developing these particular bladder conditions. Now let's explore 5 ways you can use food and nutritional supplements to help reduce the prevalence and recurrence of these bladder infections and UTIs. So number 1, we definitely want to limit added sugars and refined carbohydrates. Now, overall, it's just important to watch out for these foods, juices, even 100% fruit juice, soda, sweets, white bread, pasta, rice. These sugars can actually feed bacteria in the urinary tract and stimulate their overgrowth, leading to recurring UTIs and bladder infections. This is actually what makes the low candida diet especially helpful for these conditions, because this approach reduces sugars to help prevent that bacterial overgrowth. Number 2, you probably heard about cranberries. Now, cranberries contain compounds called proanthocyanidins, which prevent bacteria from adhering to the walls of the urinary tract, reducing the risk of infection. One study found that consuming cranberry products reduced UTI risk in children by 54%, and in women with a history of recurring UTIs by 26%. It's pretty good. It's important to make sure you're consuming 100% cranberry juice and not a drink, beverage, or cocktail that contains other ingredients, as well as lots of added sugars. Number 3, probiotics can be really helpful, especially strains of lactobacillus, which can really help maintain a healthy balance of bacteria in the gut and urinary tract, reducing, those harmful bacteria that can cause those infections. So probiotic-rich foods, yogurt, kefir, sauerkraut, or probiotic supplements certainly can also be helpful. Number 4, D-mannose. Now, D-mannose is a type of sugar that can help prevent UTIs by preventing bacteria from adhering to the walls of the urinary tract. A large meta-analysis found that taking D-mannose supplements regularly may help reduce the risk of recurring UTIs, especially for those individuals, who are prone to these infections. And number 5, pumpkin seeds. Love them. While there is limited research, their research is promising that pumpkin seed extract can improve bladder function and reduce urinary frequency and urgency. A 2014 study found in Overactive Bladder that pumpkin seed extract helped to significantly reduce symptoms of urgency, frequency, and pain at night at 6 weeks and 12 weeks. So that about wraps up our review here of bladder health and how you can think about food and supplements to boost your bladder health and prevent infections, UTIs, incontinence, watching those refined carbohydrates and added sugars, as well as nutritional supplements like cranberry products, probiotics, D-mannose. They can go a long way in supporting bladder health while reducing the occurrence and recurrence of these infections. Just always remember to consult with a healthcare professional before starting any new supplementation, especially if you have any underlying health conditions or taking any kind of meds. So thanks so much for watching, and as always, let us know if you have any questions in the comments.